Hello, is this thing on?
Do you think they can hear us?
Nah, let's say it again. Hi, and welcome to the Gritty Nurse Podcast, an unfiltered discussion related to health and healthcare. My name is Amie,
And my name is Sara.
and we are your podcast hosts.
If you're listening on Apple Podcasts, Spotify, Google, iHeartRadio, Amazon, or any other podcast listening platform, don't forget to subscribe so you can get updates to when we have our latest episodes. Also, don't forget to rate and review us.
And if you like what you're hearing and you love our advocacy work, don't forget to go to www.grittynurse.com and click on the donate button.
As little as $1 or $2 a month for a total of $12 a year will help us with our monthly podcast costs, such as website hosting, our hosting platform,
audio equipment, and the time and energy it takes us to put out good quality episodes. We thank you and we appreciate you. Hi, and welcome to the Gritty Nurse Podcast. Again, I can't even do it. I can't, Sara. This is actually a different take, an interesting episode. We need to keep it a little bit light. Of course, we'll talk about important things, and I guess, to be honest, this is still an important thing to talk about. What does sex have to do with nursing? I think that through this episode we'll explore a couple different avenues through our own stories, our experiences, and then even maybe just talk about some of the aspects of where people say, like, oh, it's unprofessional to do this, or it's unprofessional to do that, and kind of where we draw a line in the sand when it comes to sex and nursing. If we draw a line, we'll see where we get, right, Sara?
Yeah, and there's so many stereotypes with nursing, but I think the sexy nurse is the first thing that comes to everyone's mind,
Yeah.
especially if you're not a healthcare worker. And I would just like to discuss, there's that aspect, but there's also, as we nurses know, that nursing can and usually is very unsexy, and you know it. So,
Yes. It's very it's very, very unsexy. So, like, I don't know. I mean, that is one of the first things that comes to people's mind. And I did do a little quick history lesson. And I mean, I don't want to get into into too much detail, but I kind of want to really understand, like, what's this whole idea behind, these tropes of, sexy nurses. And actually, some of this information quite surprised me a little bit. So, the first thing that really shocked me was many of the original nurses were also known as prostitutes. So this was way
mhm, mhm.
back in the Protestant Reformation in the 1500s, so well before Nightingale's time. And literally, when you were thinking about women and working, there really wasn't that whole idea of women in work. And there were really only two jobs. There were, like, women who were like prostitutes and women who were nurses. And it was actually seen as a very low form of employment. So, like, we were just a step above prostitutes, according to this history lesson here, because essentially what they were saying, that lowest class women entered the workplace, and due to the high risk of infection and dreadful working conditions, nursing was literally the most dead end job around. So, like I said, it was a step up from being
Mhm,
a
mhm.
prostitute, which led in the ranks of nursing staffs being populated by workers with, nebulous sexual morals, who would often hold down more than the job of just being a nurse. They would do nursing and potentially something else. But then again, in the 1800s, there was a huge change. We could thank Nightingale for this in terms of the advocacy, and it really changed the way that nursing looked. But some of those images really continue into mainstream media as it is today. So I think there's a lot of things when you talk about, like, Valentine's Day, and
Mhm, mhm.
like, I remember, like, when I kind of looked at some of the cards, there's always, that one card with, like, the sexy nurse on it. You're like, ugh, I kind of cringe every time I look at them, like, ugh, why would I, like, give that to anybody? And then this might date us. a little bit. So MASH, the TV series, they actually had they had like a military nurse, and of course the military nurse was playing the role of the sexy nurse. And
Okay, I never even watched that show.
ever watched MASH? Oh my gosh,
No.
I can hear the music playing in my mind right now. So maybe that's just dating me a little bit. And then, of course, through pornography, this is just through research. I actually haven't seen this, but there was a show called Deep Throat that introduced nursing into the world of pornography. And I'm
Oh,
sure
yeah.
you could take that and run with what that would have looked like. And then again, the nursing trope is very easy to nail. So on Halloween, it's so easy to do that sexy nurse costume. Like we see it all the time. We see it all the time in movies and whatnot. And I think it's just that's really not how nursing is. And I think there's a lot of this disempowerment that comes with the idea that, we as caregivers, all of a sudden, it goes from we're caring for your wounds to we're caring for your other body parts. But that's definitely not the case in in my situation, at least.
And you know what? It's actually so pervasive, this sexy nurse image, that in doing research for this episode, I kept typing into Google unsexy nurse, and I'm still getting the sexy nurse images. I could not find one unsexy nurse image of nurses the way I know them. And I'm not saying that every nurse is like, unsexy, but it's just like I couldn't even find a picture of a normal nurse when I was doing this. And the thing that you said about porn is interesting too, because I really feel like it's this fetish that people have. Like, I'm thinking,
Yeah.
yes, in the porn world, there are all kinds of things. I bet if you wanted to find like a sexy plumber or like, I don't know, garbage man, you could probably find something, but the like maybe it's
Sexy
like there's
garbage man?
I'm trying to think of the most unsexy like male dominated profession, and I'm thinking like
The
garbage man.
mailman.
Mailman? Okay, okay.
Yeah, the mailman.
But, like, honestly, like, I think nursing in pornography could be its own, like, channel. Like, I'm sure that already exists, and I don't wanna think about that, but
I am very sure there are more than enough tropes within the pornography world related to nursing. But I mean, like, again, like it's just this image that really isn't true, right? Like I
mhm,
think
mhm.
I don't know, like it's kind of crazy that it still exists the way it does, where really there's really nothing really sexy about the work that's actually done. I think circling back to this whole image of, the sexy nurse, and really where there's like this doctor falls in love with the nurse, and they get busy and they do it in the hospital. It's just like that is a rare occurrence. And honestly, like, why? Like, the hospital is dirty. Like, I just no. There's yeah.
No, and that just goes back to the whole thing about being it's like unsexy it's an unsexy work environment, and for good reason. Like, we're dealing with all kinds of different bodily excretions and fluids, and, like, I don't know if you've ever gotten, like, amniotic fluid or blood on
I
your
have.
scrubs while you're at work,
Yeah.
and did you have a change of scrubs?
At labor and delivery, we had our blues and greens, so I could always just go swap out another pair of scrubs. But it wasn't the scrubs that were the problem for me. It was my socks. So I learned out very quickly to bring an extra pair of socks because my socks got splashed, and then being like, okay, so bring an extra pair of socks, and that hopefully will save you an L&D. And I mean, I don't know, it's just these ideas that people have when it comes to this behavior or understanding, sexuality in nursing. It's really bizarre, and I think that I really hope that we can turn a page on it.
No, and honestly, how we look after shift, you couldn't be or look more unsexy. Like, I think maybe I can take a Mythbusters approach to this and tell you what you feel like and what you look like after a shift, because honestly, like, the first thing I wanna talk about is sweat. So, I mean, like, you are gonna be sweating from head to toe, and it's not gonna be the kind of sweat like you have when you work out and then you have a shower like half an hour later. At least for me. Maybe this is just like me, but I would sweat a lot during my shifts. And when you have to stay in the same outfit for 12 hours, and especially now with having to put on all that PPE, it's not pretty. Your
Right.
face is sweaty. Like, my face would like be covered in this like layer of shine. It was gross. And then like pit issues, like, I don't want to go there, but you need to find a really strong deodorant when you're on shift. and I mean, your whole body sweat, your feet stink. Like, I remember going into the locker room once with this new
Oh my
hire.
god.
I didn't know her very well, and I was like, "Oh my god," and I said, "Oh, like, oh my god, something really stinks, like, somebody's shoes smell like something died in it," and then I realized they
Oh
were
my
her
god.
shoes, and I was like, "How do you come back from that?"
You can't. You're absolutely right, Sarah. When it comes to, like the sweats and the body smells, I remember kind of like my go-to, like my special bag that I packed on night shifts or day shifts where I would literally have, the oil papers. So I'd bring the oil papers
Oh,
with
to
me
blot your
because
forehead,
yes,
yeah.
well, no, it wasn't just my forehead, it was like everywhere on my face because it would be like super, super greasy. And I always brought 2 types of deodorant. So I'd always bring like
Like,
I'd
different parts of your body?
no, no, no.
Oh,
No, no,
okay.
no. So I would bring you're so funny. I would bring like the one that's like the roll on, like the antiperspirant. And no, sorry, that's
Uh-huh.
the deodorant. And then I would bring like an antiperspirant, which is like the white kind of one with like the zinc oxide or whatever. That's probably really
Okay,
bad for your
okay. Yeah,
armpits.
yeah.
Those had to come. And like you said, the nursing the nursing room where your shoes and stuff went was always super funky. And especially like working in labor and delivery, I know some people were like, no, I'm not throwing these kicks out. I'm going to keep them for a couple extra shifts. But you knew like amniotic fluid and all sorts of other stuff were in them.
Oh,
You know
Amy.
it's true. You know it's true.
Well, the thing is, like, you have to wear those shoes that are waterproof, right? Like, in case you're in the OR and you drop an instrument or whatever. But that doesn't let your feet breathe. Like,
No, they
honestly.
and then like Jordan would always make fun of me because he'd be like, you need to leave your shoes outside. And it wasn't because of bodily fluids, it was just because of like the smell that like came from those shoes. But yeah, like nursing is just not sexy. And I mean, if I was to think about like my next piece, like scrubs are, well, you know what, back in my day and time, our scrubs looked just like looked like a paper bag. Like it was just like this big,
No,
because it
honestly,
was the blues
so
and the greens,
unflattering.
right? It's unflattering. They're not cute. But nowadays they got these cute tight scrubs, whatever.
They got, like, booty lifting scrubs, like, they're elasticized and they fit your body. Like, I remember my first set of scrubs I bought for nursing school because I'm pretty short, right?
Yeah.
So I got, like, the small size, but obviously it wasn't for, like, a short person because so I had to tuck my scrub top into my drawstring pants because if I didn't, it'd be, like, halfway to my knees. Like, it was really not a sexy look at
Oh my
all.
god.
Still have them. I have them, and, like, they serve me well, like, they're really soft, but they definitely were not flattering.
So when it comes to sex and nursing, there are some times where there can be some uncomfortable situations. And what I mean by that is catching your patient in the act. I have never walked in while it was actually happening, but I think I've walked in while it was finishing up. So like I was
Are you serious?
yeah,
I thought
I
this
was
was,
in
like, an urban legend, like, I've always heard of people that knew people.
no, man, I was in nursing school and it was like a husband and wife couple. I think the husband just, I don't know if it was, I know it was a med surg unit, but I can't remember what procedure he had done. And, it was scary, I guess, for them or whatever the case may be. And I
Okay, so the
had
husband was the patient
the
or the
husband
wife
was
was
the
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 patient?
husband was the patient, and I remember, like, I
Okay,
was with him
okay.
all day, blah, 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 and I was like, "I'll come back, and I'll come and check on you," and they're like, "Okay, I'll see you in, like, 45 minutes," you do your, like, your rounds, your hourly rounds. So I remember coming back to check, and, like, the curtains were really drawn, and it was
Mhm.
like, shuffling, and I was just like, "Oh, what's that?" And I was kinda like, "Oh, is it what I think?"
Are you sure?
And I'm serious, and I pulled the curtain, and she was, like, getting dressed, and I was just like
Like, quickly? Like, was she
just like
looking embarrassed?
no! That's the thing, she didn't look embarrassed, I think they were just done. How long does it
Ew.
take after a while? Like, I don't know.
Okay, I just have to know, like, what kind of procedure did he have? Was there, like, a suture that could have popped during this or, like
I feel like he had bypass, but I mean, I honestly it was so long ago. No one talked about how do we really address that in nursing school either, like, actually
Oh my gosh. You know what? Actually, I do remember.
do you remember doing your anatomy and physiology and when they talked about when you were doing your bed bath? Oh my god, this is, like, coming back
Oh,
to
okay,
me.
I remember once they said, yeah, they said, "If your male patient develops an erection during your care, what you were s" okay, this is what I was taught
Okay,
anyway.
okay.
You're supposed to drape over that area with a sheet and or blanket and or washcloth and give this person time. Okay, that's all they ever said about that. So I mean, like,
Time.
give them some time. That's all I was told. Like, give them some space. Say you'll come back. That's all I was ever taught about this situation. Now you tell me what they told you.
So I was taught the same thing, right? So I remember when we did our clinical and they were talking if like you're washing a male patient and things start to happen, you say, I'll be back. And it's such an uncomfortable situation. And honestly, I think my main principle is if they have two working hands and they can reach, just give them the towel. Like we don't have to do
Oh.
that. Like no, I mean give them the towel to clean themselves, not give them the towel.
Oh, okay, okay. Yeah, I was thinking something else. That
Your
that would have been
mind.
lotion in that case, not
No,
a towel.
no. If we think about it, do we talk about sexual health when it comes to nursing and like do we adequately address, patients' sexual needs, especially like let's say they are in an acute care situation or they're there for a little bit longer. Do we really, talk about how that might play out cuz sex is a natural healthy part of people's relationships. We don't really talk about that with our patients. At least I don't talk.
Well, we talk about the fact that it shouldn't happen, but we don't talk about the fact that how we can actually address it long term.
But should it not happen? Like, how do we mandate that? Like, be like, okay, like I get patient to patient, right? Like, I get that can create some real messed up situations. Can we really say to a spouse, like, hey, you can't have? I don't know if I've seen it in any policy, to be honest. It's like you can't have sex with your loved one. Like,
Oh my god. Here we go. There's gonna be a policy coming
no
out now when people
way.
listen to
Come
this episode.
on.
Okay, honestly, in one of the places we used to work at one time, I had to go through all of the policies to make sure that I knew which policies belonged to our department. And I'm talking like hundreds and hundreds and hundreds of policies. I don't know that any organization would actually have a policy on this particular topic.
No, and I don't think that would be fair.
But maybe it should be something that should be at least
Yeah, like
discussed.
I think if it happens, there needs to be a conversation, right? Like I actually pulled something from the Canadian Nurses Journal, and they did talk about some lessons learned related to sexual health.
Mhm.
Sexual health and sexual needs are not adequately addressed in acute care settings, though they may be very important to patients. Nurses play an essential role and are well positioned to open up conversations about sexual health, including possible sexual activity and or other sexual needs with patients while in hospital. And further guidance, education, and support for staff is needed from healthcare institutions so that sexual health may be promoted for patients in a safe, individualized, and appropriate way. But I mean, I don't know. I don't think you can make this into a policy.
In other episodes, we've talked about like staff doing this, but not really so much with patients. And I know that you sent me that one article about the nurse, and I'm like, I think that's just clickbait. And when I clicked on it, it was a nurse in another country. So I'm not
In
sure
Indonesia, yeah, I'm not too
how
sure if it
valid
was
that
true
story
either,
was.
right? But again, another like important aspect to this is really about just being a woman and what it means to have these types of images kind of either forced on you or for people to say, hey, you can't dress like that because you're this profession. So I don't know if you saw a little bit about this campaign. It was like doctors in bikinis or healthcare professionals in bikinis, because I think it was like one physician on, I think it was Instagram and Twitter, had some pictures of her like on a vacation. She's in a bikini, and other physician colleagues were commenting saying you like should take that down, like that's not professional. And it's like, okay, come on guys, like where do we draw the line between what's someone's personal life and their private life, and how does wearing a bikini make you not professional? It's ridiculous.
Right, right. It's not like there should be certain professions that are allowed to wear bikinis and others that are not. At the end of the day, we are all people, we're women. We should be able to express ourselves how we want. And if that means putting on a bikini, then you put on a bikini. Like you're not hurling racial slurs, you're not here to promote, organizations that are racist. Like it's not about that. It's just about being able to express ourselves. And I think this goes back to our episode where we talk about
Mhm.
professionalism, right? So even if you did say you were a doctor in this situation, that should not matter. We're not wearing a bikini has nothing to do with what you do as a healthcare provider. So you're not spreading misinformation. If people don't want to see you in a bikini, they don't need to look at that. I think that's really the gist of it.
Yeah, don't go on that person's page, right? And I also just think that people need to realize that, it's your body, it's your form of expression, and it doesn't have to be sexualized. Like, I think the fact that someone's looking at that saying, "Well, that's unprofessional," it's because they're sexualizing that particular person, right? And they're seeing it as their own viewing pleasure, whatever the case may be. And I don't think an item of clothing should be this controversial situation where, people are drawing lines between whether someone's professional or not. Again, I think this is just another attack on women and women's behavior and how women are viewed. And I think that it's archaic, and that there's a lot of things that need to
Hmm.
change when it
Hmm.
comes to our bodies and how we want to express them. I don't think it necessarily means that we're showing off or we're trying to be hypersexualized. I just think that specifically when it comes to medicine and nursing, that the image behind and these tropes really are creating a huge
Hmm.
problem. But the problem is actually not the profession; it's the people who are exploiting it for their, I guess, their own sexual needs.
And I have a hard time picturing a male nurse or a male doctor putting a picture of themselves, let's say shirtless, but they've got a pair of briefs on. I have a really hard time believing that they would go through the
No,
scrutiny
they
the way
wouldn't.
that this particular doctor did for wearing a bikini. It's a double standard.
Right, absolutely. And I mean, honestly, it's just kind of like, I was chuckling as you're saying that, because the thing is, like, I have seen those tropes, I have seen those images, and, it's like other guys are like, "Yeah, that's cool. I wanna be like that too. I wanna be like that bro." But, all of a
Oh
sudden
my god.
like, a woman is out on a vacation with her friends having a drink and they're all wearing bikinis, and it's a problem. So, you're right. It's a complete double
Hmm.
standard, so
Just going back to the whole unsexiness of nursing, I actually thought of something that I wanted to mention. So, when I worked in the NICU, we went from being able to wear our own scrubs to wearing the blues and greens that you talked
right,
about.
right, right.
So, I was pregnant at the time. Like, I was really pregnant. So, I worked in the NICU throughout my whole pregnancy. And these drawstring pants will not stay up when you are like 8 months pregnant. And like I tried making them tighter and they just dug into my skin, and I talked to management and they're like, no, you have to wear these scrubs. And I'm like, well, they're not staying up. So one thing led to another, and I actually took my husband's suspenders, okay, clip them onto my scrub bottoms just to get them to stay up. Like, you don't understand how ridiculous I felt. I was like, I already looked like Humpty Dumpty. And then I had these scrubs with suspenders
Oh
underneath.
my
So just to
god.
keep them up. And then, like, that baggy scrub top that doesn't look good on anyone. And it says, like, property of, like, whatever. So I'm gonna just leave you with that image. In addition to all the sweatiness and nausea and, like, grossness, it's just not sexy.
No, and I remember actually my husband would pick me up, my boyfriend at the time, but my husband now would pick me up from, like, whether it was a night shift or whatever, or he'd see me come in, and he would look at me and I'd be like, "What?" He's like, "I You look really horrible." And I was just like, "That is
Ouch.
so mean." And he's just like, "You look so bagged." He'd like pick me up. He'd always
Ouch.
bring me breakfast, and I'd get in the car. He's like, "You have such dark circles under your eyes." I'm like, "Yeah, that's called like hard work, right?" And nope, there's no sexy time. It's literally like I eat my breakfast sandwich, roll up into my bed, turn off the lights, and be like, "Don't bother me. I'm gone to sleep until like my next night shift." So, yep, there is nothing
Mhm.
and you know what? If I think about it, I've actually never ever done the sexy nurse trope at all. Like, I've never, for Halloween, it never came to my mind to be a sexy nurse, because it's just not sexy. At least not to me.
Mhm. Well, I mean, when you think about Halloween, it's that rubber pleather type outfit, super tight, and then you've got like the hat and the tights. Like, it's just not. I might have done it before I became a nurse. I'm not gonna
Sarah,
lie, but it was only because I couldn't find any other costumes. This is the days before there was
we
Amazon,
need pictures
and
now.
you know what? I think the pictures are so old that I don't know where they are. I think this is before the days of Google Drive. Haha.
Darn
There's no evidence.
it. Oh my god. But I think just, kind of circling back to this whole image is just, I think that within the last 18 months at least, you would think that it would crush a lot of the tropes in terms of, just what we've seen in the last year in terms of COVID-19 and how hard nurses have been working and how grueling our profession is. But I mean, it's baby steps, I think, when it comes to turning the dial away from these sexy types of images, and just again to say that like nursing is definitely not sexy. Not for 1 second.
Mhm. But I think, like, one thing that we get asked a lot in interviews is, "Why did we start this podcast?" And to be honest, like, one of the reasons we started this is because we wanted to kind of dismantle a lot of the stereotypes, and I think with a lot of the, pop culture that's come out with TV shows and whatnot, nurses haven't been part of their own narrative because we're not really visible in the media, and if we don't, share our stories and raise our voices, then we kind of let people tell our stories and write these stereotypes, and they're
Absolutely.
mostly inaccurate.
No, absolutely. You kind of hit the nail on the head there, and I mean, that's why we, like you said, that's why we do what we continue to do. If we don't write the narrative, someone else will.
Absolutely.